Hi, I'm Dr. Samantha Berguglio. My patients know me as Dr. B. I'm a naturopathic doctor that specializes in hormone health and fertility care. And today we're going to talk about my thoughts on fertility. We're going to focus on conventional methods versus natural methods. We're going to kind of pin them against each other, but then also see how they work in unison. So super excited to share all of my thoughts today. So first, conventional medicine versus natural medicine. So on the conventional medicine side, we're talking about timed intercourse cycles, medicated cycles, IUIs and IVF. For those of you who don't know what time cycles are or medicated cycles, those are usually done with an RE or a OBGYN, and it's where they basically help you time your cycle. They do ultrasounds to make sure that the mature follicle is ready and you can have timed intercourse, which also kind of segues into an IUI. IUIs can be done unmedicated, but usually they use either Clomid or letrozole for those. I can create other videos on what a timed cycle and IUI entails later on, but for the sake of this video, I'm just trying to break down the options that conventional medicine has. And then we're leaded into probably the most prominent or popular version of conventional treatments for fertility, which is IVF. IVF, in vitro fertilization, is going to be the process of taking a mature egg and a healthy sperm and combining them and then implanting them into the host, whether that's you or, gestational carrier. It is definitely an option for people to do. Now, natural medicine on the other side is going to be all about treating root cause and getting to the bottom of what's truly going on when it comes to fertility issues. I can speak to this a lot, so I'm gonna try to make this as brief as possible, but in general, I have such a passion for natural medicine, specifically how it can treat fertility for many different reasons. One being that it does get to that root cause. So where an IUI can maybe help with timing and with a low sperm count, natural medicine will really get to that root of what's going on. And what do I mean by this? So for example, an IUI will help people who struggle with ovulation or low sperm count and timing, if I guess that's been an issue. But usually that's all they tend to be helpful with. So letrozole or Clomid actually help the female partner ovulate, and then usually when there's an IUI, there's an insertion right through the cervix, so it bypasses the vaginal canal, which can provide a barrier from sperm getting where it needs to go. So at the end of the day, IUI can be helpful, but usually only in those cases. Natural medicine is, we look beyond that. One, we can actually help people who struggle with ovulation ovulate, which is really cool. I help so many people ovulate naturally. There's a lot of root causes for this, such as HA, PCOS, chronic fatigue, illness, inflammation. On the flip side, so the male side with the sperm, right, there's a low sperm count or a low motility or morphology, we're going to figure out the root cause for that. Most root causes for low sperm count is going to be testosterone. So we're going to work on testosterone. We're going to work to build that up. Most common reason for motility and morphology to be low is going to be environmental factors. So we're going to work to better the environment to improve those numbers and values as well. So you can already see how, just from this example from an IUI, what natural medicine can do and provide, and maybe have you avoid doing that all at once. And why would you want to avoid that, right? I mean, at the end of the day, these were developed for a reason. A lot of times it can move things along a little bit faster because natural medicine is the slow way. I'm never going to deny that. But one, IUI can be really expensive if it's not covered. Most of the time I hear it's anywhere between, $1,200 and $1,800. So it's really expensive, and that's just for one shot. You don't even know if we've treated the root cause yet. And two, sometimes those medications can actually cause really terrible side effects, like making your cycle irregular or, making you just feel irritable and moody and cause a really aggressive period following those if you don't get pregnant, right? I could literally talk about this topic for hours, but I just like to show a very tangible example. Let's talk about if, say, it wasn't ovulation and sperm count that's the issue, but your gut health and your thyroid health is. IUI is not going to help those things, right? It only addresses if you don't ovulate or if there's a sperm count issue. So if there's other issues going on, it's not going to be helpful in the long run, and it may or may not work because at the end of the day, it's, again, not addressing the root cause. Same thing when we're going to the IVF realm, right? So we're gonna find the best egg and the best sperm and we'll put them together for IVF and then we'll implant them in mom, right? Seems to be like, wow, there's no way that can't work, right? A lot of people tell me that they feel like IVF is something that is guaranteed almost. And then when they find out the real statistics behind them, they're a little shocked. So it's not guaranteed to work. And although it does help many couples, it is something that at the end of the day, again, is not treating the root cause. So yes, if there's bad egg quality and bad sperm quality, yay, we can flush out, pick the best ones and combine them. But what if there's an implantation issue? What if there's a clotting disorder? What if there's a thyroid issue, a gut health issue, low vitamin D? The list can kind of go on and on. PCOS issue, an autoimmune issue, endometriosis, all these other things. Yes, IVF makes it a little bit more likely to work, but it's still not guaranteed because, again, we haven't treated the root cause. How are we to expect that IVF is going to work if we haven't done anything different yet? Many people that have had failed IUIs and failed IVF treatments come to me and they work with me and they get pregnant naturally and they are kind of blown away and they're like, I wish I came to you sooner. That your journey was your journey for a reason. I know that's super annoying to hear. Probably is not something I should tell to an audience of people going through infertility, but at the end of the day, I don't want them to feel bad because they feel like they wasted a lot of money. I'm not telling you that it's going to be a waste of money. I'm just saying that there's other things that we should do first to increase the chances of the likelihood of IUI or IVF working if you decide that's your path. That's kind of a good segue into, I think that natural medicine honestly should be the first step in the fertility journey, and then IUI and IVF should be after, but I am not opposed. Contrary to popular belief, I feel like a lot of people think I say my way or the highway. I'm absolutely not of that thinking at all. I am very much in support of team care, and I really think that IUI and IVF can be a really great partner when it comes to natural medicine, right? One, it can help speed the process along, especially if we've already spent a lot of time and attention healing and addressing the root cause. And two, it can give people a little bit more hope and, like I said, like speed up that timeline where they don't have to wait to conceive naturally after healing, because healing takes time and then conceiving naturally also takes time. Naturopathic medicine is slow medicine, and I like at least 3 months to work with someone. It takes about 3 months for eggs to mature and about 3 months for sperm to mature and recycle. So everything we do needs at least that amount of time. And then on top of that, if there's a bunch of other things going on, it could take even longer to heal. So, one, we have to heal, and then two, the process of getting pregnant does take a while. For couples who don't have anything else going wrong or against them, it still can take them up to a year. And that's why people say that. The success rate of having a successful conception during each cycle is anywhere between like 20 to 30% in a healthy couple. That adds a lot of time. So kind of going back to my previous point of when you have natural medicine mixed with conventional, it can kind of speed things up a little bit. And once you've treated those root cause, like I said, it increases those chances of IUI and IVF working, which is exactly what we want because we've treated the root cause, we've addressed it, and like I've said, probably sound like a broken record by now, it speeds up that timeline. I feel like naturopathic medicine should be the first line of treatment. I think we're a little flipped on some things. And so, everyone goes like IUI and IVF first, and then they all come and find me for naturopathic medicine. I think of it as a pyramid. The bottom's gonna be naturopathic medicine, the bottom's 2 pillars. So naturopathic medicine, within that first one is going to be diet and lifestyle habits. What we're eating, sleeping, movement, stress, all of those things are going to be on the bottom. Then the second one is going to be herbs and supplements. Then the third is going to be things like medications like Clomid and Letrozole, IUI, and then the top would be the IVF. So as you can see, at the end of the day, we should work from least invasive to most invasive. And I think that yields the best results, because if we have the foundations and we treat the root cause, that's where we see the biggest changes. And that's when I see people, have those crazy stories about, I conceived naturally after, 3 rounds of IUI and 4 rounds of IVF. I've seen it many times. So I know in my heart of hearts that it's able to happen. I like telling one of my really fun stories when it comes to my fertility cases, and I don't know if I'm gonna make this like maybe I should just do it on every video, is tell a cool fertility story, but this one's really exciting, and I think it's a prime example of how naturopathic medicine works so well. So long story short, patient comes to me, has had a loss, which is really sad, and then tried for about 2 years. So basically they were able to get pregnant pretty quickly, ended up having a miscarriage, I want to say around 8 weeks, and then weren't able to get pregnant for about 2 years. And they were very confused and sad and tired, and they came to me. They had previously done multiple IUI sessions. I think it was like between 3 and 5 from what I'm trying to remember. And they had all failed. We decide that we really need to test the gut and treat the gut. And I'm really happy we did, because I remember she came back positive for like H. pylori, bacterial overgrowth, and an issue with candida. I give them a treatment, and I tell them, please do not try to conceive for these first 2 months of treatment. It's all antimicrobials and basically like herbal antibiotics. We want to make sure baby isn't conceived during that time. At the end of the day, the herbals are really safe, but I just like to make sure, I just like to be extra cautious, right, during these situations. So 5 weeks go by, and all of a sudden I get a message and they say, you'll never believe what happened. We were actually not trying to get pregnant, so we accidentally got pregnant, and this was unbelievable to them because they weren't able to conceive for 2 years. And I'd like to just say this was the power of her gut needed to be healed so badly that the moment it was given actually some relief in general, her body was like, yes, I'm ready, let's do this thing. Honestly, she's in her 2nd trimester now, and she's doing so well. Things are going great, and I'm just so absolutely happy for them. It's just one of those stories that I just think is so powerful and speaks to the let's treat the root cause, because really amazing things happen once we do that. Now, like I said, if we waited some more time with this patient and they weren't able to conceive right away, we'd work with them, we'd do a lot of healing. And if they wanted to go again and jump to an IUI, I'd fully support that. Like, it's their body, their time. And I think practitioners should really embody that and realize that this journey is already really hard. Providing support is going to be everything, right? So here is my summary on everything in this video, is that conventional and naturopathic methods are definitely needed. I love that we have both of these options for people. Some people can't use naturopathic medicine because their tubes are blocked, or they have very severe endometriosis, which naturopathic medicine can actually also help with, but that's a whole nother thing. Like, there are reasons why IUI and IVF exist, and I'm so happy they exist, and they really have helped a lot of people. So I'm never gonna take away from that. But I believe that naturopathic medicine should be the first line of treatment for infertility. And later, if they need to be used together, or someone just wants to move on to those conventional methods, I totally agree with that. Long story short, I think that both forms of medicine are very, very much needed. And I believe in the power of natural healing, in healing the root cause and addressing root causes. I just hoped that this video shows you the power of naturopathic medicine and how it can be used with conventional medicine and how it can be used without. Because I feel like some people kind of glaze over the importance of the diet and lifestyle and treating the root cause, and then go back to it later when all else fails. When we, in reality, need to have a mindset shift to really address those things first, and then jump to those more extreme, immediate methods later on. Ultimately, between conventional and naturopathic medicine, you need to choose what's right for you. Listen to that intuition. Listen to what your voice inside is saying. Figuring out what's right for you is going to be important. So if the first step you need to take is IUI, then go for it. That is your decision. And I want you to know that I am back here supporting you, whatever you decide, and all those around you should be as well. I hope you enjoyed this video, and if so, please don't forget to hit the subscribe button. If you want to work with me one-on-one, look into my ebooks, masterclasses, and all I have to offer, please don't hesitate to hit the link in my bio here. I hope, again, you all have a beautiful day, and check out my next video, which is going to be on unexplained infertility.